Hello everyone. It is my absolute pleasure and delight to welcome you all to this crucial roundtable to discuss climate change and its impact on health, healthcare systems and the pharmaceutical industry. My name is Vernon Bainton, and along with Hugh Montgomery, we'll be co-chairing this afternoon's discussions. We're very privileged to have people from diverse backgrounds and expertise here. We have industry representatives, people from the pharmaceutical industry, from patient advocates, communication experts, academia, economists, and international sustainability organizations. Each of you brings a wealth of expertise and knowledge, and those perspectives are going to really drive our conversations today. And I'm absolutely sure they're going to deliver meaningful dialogue, and most importantly, actionable outputs. The objectives for today: to raise awareness and increase understanding about the critical impacts that climate change is having on health and healthcare systems. It's to share insights and be a platform for you all to discuss your knowledge, experience, and perspectives on sustainable healthcare practices and climate change. It's to collaborate on solutions. As I said, it was action-orientated, and it's for us to look to foster collaboration and break silos amongst stakeholders and help us accelerate working together on some of the more important solutions that we can come up with. It's to promote sustainable practices and to celebrate some of the good work that is actually happening, be it internationally or at a local grassroots level, and to really champion those causes. And then lastly, it's to advocate for change, whether that's policy change or financial or legal change that is actually going to make the biggest difference and change the needle. That's what we're going to be looking towards at the end of the session, to explore those calls to action. Throughout the discussion, I really encourage you to be as candid and as open as possible, and perhaps not shy away from some of the more challenging issues, the barriers that are holding us back to make change in this space. Bearing in mind it is complex and it's interconnected, and this intersection of climate and healthcare is a difficult challenge for us all to work on. So the way that we're going to run things is in 4 sections. The first topic is going to be population health and the impact of climate change. We're going to be discussing how rising temperatures, extreme weather events, air pollution and environmental changes are impacting population level health, with a particular focus on vulnerable populations. We'll examine the direct and indirect health effects, including the spread of infectious diseases, respiratory, cardiovascular, as well as mental illnesses. The second section, we're going to focus in on how climate change is affecting various aspects of healthcare service provision, and the pharmaceutical industry. We'll explore the infrastructure, service delivery, and resilience of health systems and what needs to change there. Additionally, we'll look at the pharmaceutical industry, the implications for it across its entire value chain, and where we are making some differences or where we need to make some changes. The third section will probably be the bulk of our conversations, where we'll be exploring sustainable practices in healthcare. We'll explore how those sustainable practices can significantly reduce or help to mitigate the impact on healthcare systems and on patient outcomes. We'll discuss innovative approaches and best practices and really shine a light on what some of you are doing and some of your organizations are doing. And then the fourth section is policy advocacy and sort of incentives and disincentives. We'll be looking at the role of policy, of advocacy in terms of climate-related health issues, and how can we promote sustainability and incentivize those changes that address the health impacts of climate change. So thank you very much for being here today, and without further ado, we'll get started. So first up, population health and climate change. Phenomenally big topic and some stark and quite terrifying stats. The World Health Organization has declared the climate crisis one of the biggest global threats to human life and human health. Hugh, you've been at the forefront of this topic and gathering evidence for upwards of 25 years. So what do you find the most compelling evidence of the impact on climate change and health?
Well, I'll keep it brief because there are experts in the room. I think it's a bi-directional issue. So there's the drivers of ill health that are causing climate change. So if we look, for instance, at particulate pollution causing millions of deaths, suffering, COPD, asthma, dementia, coronary vascular disease, a whole raft of diseases there. Look at the food supply chain, 38% of global greenhouse gas emissions, 22% of global heating coming from methane, with farming being a major contributor. And these are causing huge increases in sickness and ill health, which themselves have a carbon footprint. So that's that direction. The other direction, I guess, we focus, some people in this room are on the same countdown as I, and we focus originally on the vector-borne diseases and dengue and salmonellosis and other things. And actually, increasingly, we recognise they're to a very substantial degree irrelevant. The big threat to human health are the social impacts, the economic collapse, which economists and security are warning us about, and the impacts of mass migration and all of those on war and health. So those are the big ticket items, I think, for us to cover.
And some of the data points behind that are really quite abstract, aren't they? They are that large. When you talk about, by 2050, 2 billion individuals being affected, with trillions of dollars being lost globally to the economic environment.
Yeah.
Are they too abstract for people to actually connect to? Is that part of the trouble behind some of these statistics?
I turn the question back to you and your team here, because you're the experts in communication. I personally fail to understand. The data are now, as you know, widely reported from every sector, actually, that we're looking at 4 billion dead or migrating within a matter of a decade or two. That's half the world's population. And none of us would escape, because once the economies have collapsed and you've got that sort of level of social disruption, none of us escape. I fail to understand why any of the messaging hasn't landed, but that's you're the expert in your team here, so I'd ask you why you think these messages haven't landed really.
I think that there's a multitude of problems behind all of that. I think making it relevant to individuals personally and within their environments is fundamental. Nudges don't tend to last, and we need better incentives and disincentives. Just telling people is not enough for us to actually promote behaviour change. We'll come on to some of those solutions a little bit later on. But you know, since the 1990s, heat-related mortality has risen by 85%. The last 50 years, things have accelerated and continue to accelerate at a pace that we have not been witness to before.
And that acceleration won't slow.
No.
That's the problem we've got. So I guess, going back to your first question, how do the people in this room, all of whom are experts, how do we address those particular issues?
So we touched on some of the aspects, but climate-related health impacts include cardiovascular, respiratory, infectious diseases. We know that every 1 degree above 17 degrees increases admissions rates from heart attacks, from strokes, right the way through to dementia. Every organ system is affected and every therapeutic area is impacted by these conditions. So we will not have a health system to be able to maintain these things if we don't address them, because the impact on them will be so high, right?
Yeah, and it'd be really interesting to hear from the representatives of the pharmaceutical and industries here, because of course the traditional approach, not that I'm suggesting in any way that pharma views climate change as a great opportunity, but it's just that the model has always been to treat the disease. So we have an obesity epidemic which is driving climate change because of the impacts, for instance, of diet, but the response is to develop GLP-1s. So we come up with a drug that will treat it, as opposed to, I think we've got to find some way of switching the tap off whilst pharma can still make its profits, because there are companies that need to do that. So that's, I'd be interested to know. I don't know if that's something we could put to those in the audience.
So there's a massive opportunity for systems thinking here, right? Where actually we start looking at things that are interconnected rather than in silos, and putting a Band-Aid over a solution. Sheuli, you want to come in?
Yeah, I think I'd pick up on the point about systems thinking. So, I'm president of the Faculty of Pharmaceutical Medicine, where our members are doctors who are working on development and use of new medicines, medical devices, diagnostics, and that remit is expanding as we get AI and digital health and different kind of essentially developing tools for clinicians and patients to use in relating to health. And it's been very traditional that you're working, so I've worked on medicines where you're very much focused on that medicine for that disease area, working with clinicians in that field, thinking, yes, let's take hypertension. Here's a new medicine for high blood pressure. What would you want from a new medicine? How might it work? What kind of research do we need to do? And clearly that approach is not sufficient in that we need to be, I think that doctors working in developing new medicines and new tools need to be thinking, where does the thing that I'm developing, where does it fit in? Where does it fit into the bigger picture? How would it be used? So it may have for example, a carbon impact of itself, but actually, if the medicine is effective, what carbon would it reduce in terms of preventing admissions, for example, as a very sort of basic level. But what we found is that at the faculty, as we're starting to think about, where can we helpfully add rather than just create noise that's not helpful. It does start to, that systems thinking really starts to challenge some of the fundamentals around developing new technology. So we talk about a risk-benefit ratio of, say, a new medicine. The benefits outweigh the risks. But what do you mean about benefits and risks when you're taking that broader perspective? Is it just lowering the blood pressure versus the side effects from the medicine, or actually it's much broader? As an example, so it's really kind of challenging us to think what do doctors who are working on new technologies, what do they need, what perspectives do they need to be holding as they develop those technologies?
That's great to hear. That really is. And in terms of those strategies, so you work at that with clinicians that are at that Faculty of Pharmaceutical Medicine, at that forefront of innovation. Innovation is always an interesting one, isn't it? Where there's technology that's involved in that, and which can be a double-edged sword, right? So we often push towards technological solutions of things when actually frugal innovation is maybe more a sustainable approach to some of these things in a healthcare system. Have you had any thoughts on that?
Yeah, and one of the crucial things that, as pharmaceutical physicians, one of the crucial things that we do and will need to do is also be very clear where the technology, whether it's the medicine or something else, is not the answer. So that, giving a medicine to lots and lots of patients may not be the right thing to do. It may only be a subset of patients who need it, and all those other patients, that medicine should not be given. And that's where one of the roles of the pharmaceutical physician is to really work with the teams to say this is the appropriate prescribing, or the where the technology is appropriate. And other times it may well not be the right thing to do, and that's rather than just saying, oh, anyone who could have the medicine or use the device or whatever should have it. It's actually being very mindful to say these are the people who could benefit, and it's back to that benefit risk thinking.
Yeah, absolutely. So we know there's a whole host of challenges across the whole health spectrum. We'll talk a little bit between prevention versus healthcare as well, because there's a very interesting interplay between avoiding illness versus managing the illnesses that are then caused through climate change and through other issues. We know that healthcare is a contributor as well as part of the solution. So healthcare itself contributes about 4.5% global.
Somewhere between 4.5 and 5.1.
So around 4.5 to 5% of global greenhouse emissions. The pharmaceutical industry is at the forefront of developing innovative medicines in that space, but the whole manufacturing, supply chain and delivery of healthcare systems needs to be thought out more broadly about where it is a net contributor versus where it is improving the situation. So it puts it at an interesting intersection to be part of the solutions rather than just part of the problems. So what are some of the most pressing challenges we see within the health systems? Debs, shall I come to you?
I was going to come back to a point actually before that one of the most sustainable ways we can help is by prevention. and health promotion rather than treating illnesses. And actually, we need to be not necessarily prescribing medicines for people, but we need to be influencing people and helping support people to enable them to understand that they can lower their blood pressure by healthy eating and exercise. So there's a lot we can do before we get to medicines, and indeed it's one of the government's 3 shifts, isn't it, to move to prevention. So I think we need to be thinking about that and what we can do in communities as well to support people and how we work smarter.
Can I ask you a question then, because you and I both face the patient coming through the door, and I'm sure your general practice is the same as my intensive care unit. Most of what I see is entirely preventable. But we seem to focus on the individual to say, you've got to eat more healthily and you've got to take more exercise. Where would you sit on the legislative part? Because I'm very strongly in favour of legislating very strongly to get the food industry to pay for its externalities and to get because it's not easy to tell a poor person to buy what they perceive to be more expensive healthy food, is it?
I think that's a really interesting point. I think there are bigger health inequalities that we have to deal with because often people don't have the right money.
Yeah.
People aren't even able to get food where I work,
Yeah.
actually. So we are delivering food parcels to people. People are socially isolated since COVID. So there are other factors. So it's really about person-centred care and enabling people and asking people what matters most to them. And actually, I'm not going to treat someone's diabetes if they actually haven't got a house or they can't feed their children. It's about looking at that bigger picture and supporting people. And actually, if you can make small changes, then you can get people on your side and then you can start to sort out their diabetes. But giving them 3, 4, 5 tablets that they sometimes haven't got the transport to pick up, they can't afford the prescription, you've got to think about the person to begin with and support them in their environment and their community, and there may be things around them with voluntary services that we can support them with, and then tackle the illnesses. But we need to be listening to people and valuing what their thoughts and enabling them.
There's fundamentally a piece around injustice here and the social determinants of health more generally, because they're the ones that are, those are the people that are going to be most impacted by the climate change and the impacts to the health system. But just coming back to healthcare provision and the pharmaceutical sector, where do we see the changes happening within health systems? Are we starting to see that already? We did a piece of research last year in Europe, talking to healthcare providers and patients alike, and 66% of them said they were fully expecting to change or need to change their clinical practice because of the impact of health, but the systems weren't necessarily set up to meet those changes. You're nodding clearly there. Can I?
No, I mean, I think it's... So one of the challenges that we have is that because of the increasing burden of disease that we're already seeing as a consequence of climate change, is that burden is predominantly being placed on the primary care physician, on the patients themselves. So unless there's systemic change around that to support them, then they're just going to be in a kind of vicious cycle where things are constantly going to get worse and they're going to struggle increasingly in the future. It's also unfair to place that burden on the primary care physician and the patient when it's the wider system that's actually responsible. So I think from a pharmaceutical company perspective, what we really need to get better at doing is identifying communities of people who are both vulnerable from a socioeconomic perspective, but who are also exposed to climate change and its impacts. And then from a company point of view, and I know, Hugh, your point about this means business opportunity for us, and is there a perverse incentive there? But unfortunately, the future that we're looking at, there's going to be more than enough disease around for everyone, unfortunately. And so I think as a company, we are there as a primary prevention supplier of medicine, a secondary prevention supplier of medicines, but we can also do a lot around education and support primary prevention as well. And I think that's the shift in mindset that we need to take internally within the business. That
it's a good question. And can I mean, you made me think of something which I've actually, oddly enough, not thought of before, because clearly the health systems globally are collapsing. And I was on call last night for my intensive care unit. We had 57 people waiting for admissions with no beds in the hospital. I couldn't get anywhere out of intensive care. The whole of London's log jammed. Yeah. And it's not sustainable financially, and less alone in any other way. So if it collapses, there won't be any money for a drug company at all. So maybe there is an opportunity to be working together, because the drivers of ill health are often the drivers of climate change. Yeah. By bringing those down, there'll be an economy left to support a drug company.
I think another example is what we've seen in the Philippines is that during a recent typhoon, healthcare clinics closed, and that actually caused a decline in our sales. So it actually directly impacts our business if we don't have resilient healthcare systems who are able to provide continuous access to medicines. So these things are so deeply connected that we need to be seeing them as integral to the resilience of the business itself. So I think that's a really good point.
Debs.
I think with population health and the data that we have, we need to be looking at our communities that are struggling. And with the new neighbourhood health model that the government is also talking about, we can work smarter. There are a lot of processes in the NHS that aren't necessarily valuable, that we could be working smarter, preventing duplication of our services, working as teams together in the community to identify these people. And my village, there was a critical incident 2 years ago. My whole village was underwater, and the people that were impacted most were the older population who couldn't call for help and couldn't get out their houses. And, you know, it was lovely to see the community come around, but we don't actually have a database of those people. And we do need a database of actually who is vulnerable, who has severe frailty to support in those situations.
It's a really good point, actually, for those of you that aren't familiar with the Valencia floodings in November and the huge numbers of people that died. To a degree, that's because they put the call out late, but when they put the warning out late, they told everyone to stay indoors. And the elderly and the disabled did stay indoors and then drowned because they were the people who couldn't get up the stairs or get away from the flooding. So you're right, there is. Sally, you've been in this space a lot. You're being very quiet.
Yeah, it's unusual, isn't it, actually?
Yeah, it is.
No, I'm listening. I'm loving the sort of deep perspectives. I suppose I'm sitting here thinking that absolutely tackling climate and health is the quintessential systems change challenge. And I say that from a point of view of, I'm at Forum for the Future, we're a sustainability non-profit, but one of the projects that I co-direct is the Climate and Health Coalition. And we've now been working, so we're a non-profit, but we convene private sector actors and non-private sector actors in the climate and health ecosystem to really enable the conditions in which the private sector can really step into providing solutions at scale. And the reason I got involved in that work was, you know, I'm more of a sustainability person. I'm not a health expert, unlike many of you in this room. It really dawned on me, I think it was 2018, that everything a business does, not just in pharmaceutical sectors, but more broadly in food, everything you do to reduce carbon has a health impact. Everything you do to build climate adaptation has a health impact. And yet, in most organisations, the net zero team is over here, the health and wellbeing team is over here. And I just suddenly thought, well, what happens if we try and connect this across organisations and really enable organisations to take actions that drive co-benefits for climate and for health? And it's been a fascinating journey. We've produced multiple sets of guidance documents, and also we've been trying to make the case for change within the private sector, because in pharmaceutical, some of the links are obvious, but not actually as obvious as they could be. Outside of healthcare sector, the awareness of the links is actually much lower. It has increased a lot over the last few years. It's very clear in the built environment that green infrastructure is great for health, it's great for carbon, and we can see a lot of these links. But in terms of, you know, how do we move forward from this moment in time where our health systems are creaking? First of all, it is a systemic change, and the system at the moment is mostly designed to fix us when we're poorly. And so the goal of the system has to be very explicitly about keeping people well. That's a massive opportunity for the pharma sector, because they've got access to the innovative techniques, services, products, but also the brand education. And so that's the first thing I think that's missing, is that shared understanding that what we're talking about here is a different set of goals for the health system, and also a different set of goals for the energy system. Access to energy, to heat, mobility from sources that are renewable energy sources. And so what we've been trying to do within the Climate and Health Coalition is make the case to integrate these agendas, make the case that this is a point we need to shift systems, and systems only change when I articulate a different set of goals for the system, and then to provide guidance. And we're now working with a number of healthcare, private sector organisations food businesses, we've got a business who's very active in the built environment. And we're really trying to mobilise them to work across the private sector, but then critically with the public sector, with civil society, to create these solutions at scale, because ultimately it's articulating a different set of goals for the system, and it's mobilising both private sector and then collective action across the private sector that will allow us to respond to the climate crisis and the health crisis, which are just two sides of the same coin, at the pace that we really need to happen. And I'm happy to share more about the guidance, but that's why I'm here, because I actually see a huge opportunity to shift the climate story and the health story by bringing them together and effectively making the conditions in which everything you do drives multiple benefits in multiple systems. That's how we'll get accelerated systemic change.
I'm just wondering if I could bring in the economists in the room, because we've got the title there of the impact of climate change on healthcare, and the big impact, I think, is going to be economic on the companies and their ability to do business, on the finance the healthcare sector can support, or how much the healthcare sector will be damaged by the loss of that, and also the other economic impact socially and the social determinants of health. But so I don't know who wants to go first. We've got two people who understand money in the room. I don't.
I think Paul and I take different perspectives on this, don't we? But so I think, well, one, we've got evidence already that climate change is having an impact on GDP and GDP growth, and it's having an impact. For example, we see it on labour supply. And so I suppose here we're trying to make arguments, aren't we, to get governments to act. So, there's a lot of evidence, and we sort of all know a lot of the evidence, but maybe we can get governments to act if we can show them more clearly the costs of not tackling climate change. So globally, we know that in most countries, maybe not the coldest countries, in most countries, climate change is already affecting GDP per capita. A lot of it looks like it's through labour supply. It's also affecting people's ability to work because of food. We've talked a little bit about food, but health and nutrition. So people get it if you don't have a good diet, if you don't have access to food, and when you get an extreme weather condition, often the cost of healthy food goes up. So you get a very clear spike in the data, whether it's Burkina Faso or whether it's the UK. We can pick up in the data that when you've got extremes of weather, food insecurity goes up and people can't access healthy diets. So there's a lot of clear evidence. I suppose at a country level, the global evidence is not going to help your Treasury Department because we've got a global public bad, but we've already heard a lot of the actions we can take that make sense economically. So, cleaning up air pollution, healthy lives and active transport, which all takes the pressure off your GP or off your intensive care unit. So but even, so having the economic evidence can help. And I think you've got to ask at what sort of level of granularity you want that evidence. So do you want it for local councils? Do you want it for, sort of healthcare sector at a certain level, or do you want it at the country level for the Treasury? But I think sometimes I say all roads lead to finance these days, that if we can show the Treasury that they can save money by taking climate action that's sort of got health co-benefits, that might be an indicator to get things moving.
Is there a lack of incentive or disincentive? Because it's great to have the objectives, and we can certainly agree there's challenges. Showing there's opportunities to tackle problems and the financial costs is one thing, but actually part of the barriers here, there isn't enough specific incentives and disincentives in place to make those changes. I don't know.
I think they are emerging now, and so we absolutely need to make the case for governments. And because we do need government and the private sector in particular to work much more together on this agenda, making the so-called business case for the private sector to act on climate and health is also really important. And that's what we've been doing through our work. And it starts with a healthy workforce is a productive workforce. Product service innovation that allows you access to new markets through actually enabling people to avoid the worst impacts of exposure to climate change is also good for business. Supply chains that are resilient and healthy are also good for business, and brands that are loved and adored by consumers because they're giving them access to tools, education, are also loved. But we don't tend to talk about the business case in quite that way. And I think we need to do that more, because we've got many private sector actors, I think, at the moment that are not convinced that actually climate and health are linked, and that the business case is strong enough. And that's even true on climate, where the data is so clear. The value at risk from climate is just eye-watering. But the more we can kind of show the business case from tackling these two issues together, the better. And that's partly what's been missing. And so what we're trying to do through the Climate and Health Coalition is shine a light on that business case, because we're going too slowly. The private sector is waking up to this agenda too slowly, and we need to see accelerated progress.
Can I bring in the pharmaceutical industry on this? So we see net zero commitments on scope 1, perhaps aspects over the coming years, which we can explore a bit more detail in a second. But how are your companies thinking about the supply chain development, manufacturing, R&D, delivery? How are they thinking about climate change in this setting?
First of all, coming back to a really important point that you made previously, so it should be that sustainability is an integral part of how we are doing business. And I think this is also giving me hope, because we are developing in that direction, and just making sure that it's not getting lost in the agenda, and starting at a point where we can see that we have impact with our employees first. So I think this is the first evidence where we can start, where we can have an impact, and where we also should start raising awareness, looking after our employees. And as you said, it's a healthy workforce is also contributing to a healthy economy. And then in the next step, going beyond, and of course, also looking beyond the pharmaceutical sectors, it's about joining forces. And I think this has happened not enough in the past, and we need to see more of that. So being rather new to this whole topic, I see that there are so many different expertises available, and we just need to tap into them.
Can I ask you a question, because out of ignorance? Is there a competition law problem, pre-competitive conversations? So is that something that limits your ability, let's say, for Bayer to work with, let's say, AstraZeneca or Pfizer to set some rules that you will all stick to in the way you behave? Is that something you're allowed to do, or is that something that law stops you doing because it's a pre-competitive or competitive conversation?
Well, for the definite loss, I think we need to ask our legal colleagues more in that direction. Yeah. But talking about collaboration on the pharmaceutical company level, this is definitely existing, and we see that growing. And I think bringing the right people together that are working on the same topics is just adding to that. But I think
no barrier, Sally?
As soon as you start to talk about pricing, then it's illegal. Right. But you can bring competitors together quite easily on a multiplicity of topics and still be the right side of competition law. Okay. All of the work I do is on a pre-competitive basis. I have direct competitors in the room, but I have to read out an antitrust statement at the start of each session and make sure everyone is clear that we will never talk about pricing, we'll never talk about market share. If you set up the conditions like that, then yes, you can have that pre-debate. And what is critical, and I've written a lot about this, is the barrier isn't competition law or antitrust law. Right. The barrier is a shared understanding where the line sits between what I compete on and what I need to collaborate on. Okay. And actually that line is moving up the whole time, because as we're seeing more and more volatility in supply chains, we need to collaborate because these are shared supply chains. And so a lot of our work is to kind of clarify where that line is between I'll compete with my brand here, but I need to collaborate with my peers here and create that shared understanding. And then we can put in place the frameworks for that pre-competitive activity.
And can I come back to ask Liz one question? Again, out of ignorance, it's great to have experts in a room because I get educated. The issue of we're able to say to a government, let's say, that we can improve an economy because we spend less on healthcare, we have more people in health who are then working and creating, paying their taxes and so forth. Is that a message that lands? Because I was told by a previous person in the government that actually sickness is great because it drives people in hospital, and then doctors like me get paid to look after them, and nurses get paid, and people buy stuff from drug companies, and there's more manufacturing, and there's nurses needed, and that actually sickness is a good thing for an economy, not a bad thing. Is that true, or is that...
The way we measure GDP, well, you can say it's a good thing for an economy, or you can say it gives short-term boost to GDP. But I think where we're at in somewhere like the UK, we're past that. Right. So we're past that point where, because yes, when the way we do economics, which doesn't really make sense when we're hitting planetary boundaries, is as long as we're doing stuff and it's active, it pushes up a GDP, and if we chop down trees, that's great because, it pushes up GDP, or if we have more people sick. But I think we've gone past that point where we can say it's generating an industry of sickness. because there's such a, the waiting list, the fact that people are unable to work because they can't get treatment. I don't have the data for it. We've got to have gone past that sweet spot of looking at GDP.
But the message isn't landing at the moment, is it, politically in Britain? We're hearing the pushback saying, as opposed to saying there are jobs in clean, green, and it's good for health, we're getting the money's still back in the fossil fuels.
Well, I'm going to pass over to Paul soon because that's an area of his expertise.
Yeah, I've got a slightly different perspective on that. I hear this a lot, that doing bad stuff is good for GDP. And I think it's just wrong. So
short term.
Well, whatever.
It's definitely
but
wrong.
let's just imagine we had a healthy society. Let's just imagine that people like Deb's here managed to get health promotion such that we had health prevention. Sure, lots of very skilled people who currently make us well would find they could go off and do something else. And they would go off and do something else. You wouldn't just sit about because there are no sick children to heal. You'd say, great, I can go off and do lots of other stuff. And that would happen. And it's especially not true when you've got very low unemployment. We talk a lot about the need for green jobs and stuff. We've got unemployment at record lows, and there simply are not the people to come and do that work. That's one of the arguments around the immigration issue, that there's lots of sectors that are desperate for people, but they can't find them. And in fact, the health sector is one of those, and the education sector is one of those. So if we could actually manage well with far less illness, we could have more teachers. We could have all sorts of other people doing constructive stuff. There may be, if you had a lot of unemployment, and this is the short-term point that Liz was making, it may be that you could employ people to dig a lot of holes and fill them in again. In other words, engage in useless activity. But if we could make people well, then we could have a much smaller health sector, and we could be doing much more of other things that we would want to happen. So I think one of those most pernicious, actually misunderstandings about GDP is that, the more bad stuff you do, the better. That is just not true.
And I think I was thinking of your point from Bayer's point earlier on, that if you do treat people effectively, you can lower the carbon footprint of downstream healthcare.
Yeah.
And the NHS, like most health systems, isn't very good at that. If we take imaging, huge quantities of our imaging is utterly pointless. And at 13.5 kilograms of CO2 per scan, it's CO2 emitting. And that money might be much better spent on a drug that get people out of hospital.
And that's where this issue does become quite complex because, of course, increasingly we've been asked to provide data on the carbon footprint of our medicines, but we have to take that data in the context of the patient care pathway. Like you said, if it's a medicine that actually prevents the need for hospitalisation or prevents the need for multiple healthcare visits or prevents the need for costly dialysis further down the line, then actually that medicine could be carbon effective, if you like. So it's really important that from a medical perspective, which is where I sit in the business, that we're able to really fully contextualise that data so that we can inform our customers, which is the healthcare system, healthcare professionals and patients, in the most appropriate way to make the right decisions so that we're not.
I'm just mindful that we didn't pick up on Vernon's point from earlier on about scopes 1 and 2. I mean, scope 1 and 2 are relatively easy. I mean, they can be expensive and difficult, but they're relatively straightforward. Scope 3 is really hard, isn't it? Because the carbon footprinting registries for up and downstream activity, if they exist, are diverse and probably not that granular or detailed. And if you did have those data, firstly, is that a barrier? And secondly, if I were to give you the full registry data, how would you weaponize it to change the footprint for your scope 3? Because that's hard, isn't it?
That's a very challenging question. I maybe refer back to what Sally was saying earlier about this need for pre-competitive collaboration on the scope 3. I would say as well, just so that everyone's aware, I work in medical sustainability, so my voice within the company is to very much make sure that I'm advocating for action on mitigation, but I'm actually not the carbon expert in the company. So I would defer to my colleagues. But I want to make that point clearly because I don't think there's enough medical people within companies paying attention to this issue at the moment. And it's quite a lonely place to be at times. And so if anyone's listening to this who works with the medical, I think there's way more that we can do to advocate for faster action across scope 1, 2 and 3 to reduce our greenhouse gas emissions across the industry. We may not be the experts, and I think that's why we maybe hold back sometimes, because when we get uncomfortable questions like the one you just put to me, I'm not the expert and I don't necessarily have all of the technical knowledge behind that, but I know what you were saying earlier about the healthcare consequences, and that's what I care about and that's what I'm trying to avoid. So I still think that we have an important role to play that we're not fully leaning into yet.
Yeah, and if I could just absolutely echo and build on that point, one very concrete example of, if you like, disconnects between within companies when thinking about this is, for example, designing a clinical trial. So you'd say, thinking 10, 15 years from now, which is a point we can come back to, that future sort of demand signalling, if you like, but 10, 15 years from now, we want a medicine that treats this particular disease. We need to design a series of clinical trials. What do I want in my clinical trial to look like? Which you have someone, you know, like myself or Emma, perhaps sort of sitting going, right, what should we do together with some colleagues? A lot of people who are designing those clinical trials won't necessarily know the carbon impacts or other environmental impacts of the decisions they're making. So AstraZeneca have done some really nice work actually quantifying the greenhouse gas impact of their clinical trials, and they found that there were certain things that really drove up the carbon impact, one of which was storing samples. So there were obvious things like, if you get patients to come into the clinic more within a trial, that's obviously going to increase your carbon footprint. But one of the things they pulled out was samples, and actually, so for me, if I'm designing a clinical trial and go, oh, it'd be really nice to keep some blood samples from these patients so that 10 years from now, when we're looking at something, we've got these to refer back to, and that might drive research in the future, without necessarily thinking, okay, but the collection and storage of those samples for maybe 10, 20, 30 years, what does that mean? Do I really want to do that? How do I trade that off? How do I think about it? Which then comes back to this pre-competitive space need to actually say what is an appropriate way to approach things like this. We need research, absolutely. We need the research. We need to be thinking about the innovation, but even then, how do we think about that for a world that we can't necessarily imagine 10, 15 years from now? What is the innovation we need? What do we do now? How do we trade that off?
So what I really like about this conversation, shifting to practical solutions and what those actual challenges, because some of these could be quite theoretical discussions, right? So I'm going to come to Mark and working in the clinical trial recruitment space, and downstream, how can we reduce inefficiencies and waste in that setting? But I'm going to throw it out to ask the pharmaceutical industry what they're looking at across the whole supply chain and where they're working, and where we focus, I'll come in afterwards on, which is actually the downstream, because a lot of the effort is on the scope 1 side of things, whereas where we are in the health system, and I'll come back to you then, Debs, about what's actually being done out there in health systems at local levels. But let's go to clinical trials, R&D. It's a massive part of our industry, huge, and things are duplicated, and wastage is massive across the system, right, Mark?
Yeah, and I guess it's a really interesting point as you sort of touch on in terms of protocol. So we work in primarily finding patients for clinical trials globally, but then also helping with consent and retention and the kind of challenges that we see in trials. And so often I think you should say there's that disconnection between the design of the protocol from the patient perspective and how that's going to affect not just the sustainability elements within it. And I guess there's that challenge to think of all the data points that you may want that may benefit the future use of that product, but that can create huge burdens on the patient and create additional visits and additional things that may or may not be necessary down the line. And I think as so many companies that we work with, a lot of the activities that they design around a trial are quite centralized, tend to be sort of US focused and then just distributed to everyone else in quite a fairly repetitive kind of fashion. It leads to so much wastage in all of the aspects of the trial that we kind of get involved in. So we'll see that lots of materials and things are generally, there's so much paper still involved in times that when you get to consent and you get through all of the appointments and all the visits and all the recruitment activities, there's pretty much boxes of stuff shipped all around the world to locations, almost exclusively not opened in most of the locations, and sort of thrown out. A lot of the stuff that we get involved in is simple things, just like looking at on demand and actually speaking to the sites around the world to see if you're going to use the things before we ship you endless boxes of things to get involved in. One thing I find really interesting, I'd be interested to know from a sort of science perspective, whenever we go and work with investigators or go into sites running actual clinical trials, they always have the medical devices written into the protocols. They tend to work with 4 or 5 competing pharmaceutical companies on 4 or 5 competing trials. And if you go into a site, you see 5 of the same machines sitting next to each other because they've all been given the ECG machine and whatever other machines. You'll see a little pile of 5 different medical devices, all provided, all the same brands, all the same things, because they're tied to the protocol and they're supplied. And I don't know the answer in terms of if there's a way around that from a kind of collaboration point of view. Usually the sites, and obviously sites vary massively in terms of whether they're a huge hospital or a small kind of facility in different countries, but they tend to have the machines already, and then they get 5 more, and there's just a huge amount of waste from a medical device point of view. I don't know if there's a reason for how that kind of happens, and if that's something from a regulatory point of view that can be if there's opportunity for collaboration there, just from a cost and kind of production point of view. If that's something you've come across in terms of.
Yeah, I mean, I think it's a great, very, as you say, very practical. What is stopping that? I suspect words like quality and regulatory adherence, etc., would come into it, but that doesn't mean it can't be challenged. And there are, whether it's cross-industry trade associations or initiatives, there are a number that exist to try and harmonise clinical trials, and it feels like that would be something that could sit within that. I'm also reminded that the latest version of the Declaration of Helsinki that governs sort of principles around medical research now actually has a line in it about essentially paying attention to environmental and planetary impacts. It's not those exact words, but there is now a statement within that is kind of saying how we think about research needs to include thinking about the planet as well. So I think, it's the kind of thing that's grown up organically, and then at some point you need to say, is this really the most effective way to do it?
Yeah, and I think it's interesting how so many sort of protocols almost roll over from one study to the next, and sort of the technology and the ways of doing things sort of continues kind of on a basis. And I think, there is an opportunity. I've not seen too much collaboration in terms of that space, particularly in terms of how, but we're sort of on the ground seeing so many kind of areas of duplication, and things feel like a long time. My background's consumer marketing, and I kind of landed into trials, and I was like, this is, we're using paper for everything. This is kind of like a world that I wasn't.
But does that go back to your integration point? Because if you are designing clinical trials and you've got a strong sustainability program, you've got carbon reduction targets for scope 1, 2, and 3, you will have a design principle that wants to reduce carbon emissions during the clinical trial. But if you haven't integrated sustainability into your core business practice, you'll miss it. And so for me, this whole kind of conversation just underscores the need to, integrate sustainability issues into mainstream business strategy, because if then actually we want to deliver clinical trials with a stated objective to reduce carbon emissions, you wouldn't have what you've just described at all.
And it would be in everybody's interest.
Exactly.
I go back to a piece of data again. This is research from last year from advocacy groups. So we were talking to advocacy groups around the world. 93% of them said this was a fundamentally important topic, and 55% of them said specifically protecting the environment should be part and parcel of what the pharmaceutical industry is doing, and would play a key role in how they build your relationships and how they work with you. So I go back to, we'll come back to the industry in a second, but clinicians, we don't have a patient, we should have an advocacy individual and somebody from the advocacy world with us, but I'm just going to make sure we are voicing the words of the patients. We know that actually a large number of patients do want to know the credentials of the environmental sustainability of the healthcare that they are receiving, but we also know they don't have that information. That information is not readily available, and there's a discrepancy between the two. Debs, what are you doing in terms of medicines optimization, recycling, and the downstream aspects of more sustainable healthcare?
We all know that lots of people don't take the medicines that are prescribed for them. And I think the WHO say 1 in 2 people don't take the medicines prescribed for them. So I'm a GP and I work in the community. I do home visits primarily, generally to older people or people with complex multimorbidity on lots of medications. And as part of our review, we will ask to see people's medicines in the home. We ask them to get them out and show us them. And we ask them to find them from upstairs, downstairs, bathroom cabinet. We'll have a good rummage round for them. And 1 in 4 of the patients I see, or the people I see, don't take large amounts of medication. So we're talking 3 to 6 months or 2 years of insulin pens. We'll find a whole year's worth of antidepressants that aren't being taken. And these people have all had medication reviews by their prescribing primary prescribers, whether that be GP or advanced care practitioners. And people aren't picking up that people aren't taking these medicines. And these are people who are then going into hospital or needing district nurse care because they've got swollen legs or infected legs. And then the hospital don't realise they're not taking their medications either. And so we started Show Me Your Meds, Please, and we sensitively ask people, and we show the surgeries and the people working the system the impact by taking in the medicines into the surgeries and plonking down bin bags full of medicines that aren't being taken. And that's how we get buy-in to people then looking at medication. So anyone who's going on a routine visit, so I work with district nurses, rehab team, they all ask, whether that's social worker, voluntary services, family. We ask everyone to look and have that conversation, to empower people to have conversations with their prescribers. And we have it just normal conversation now. And we've spread that across the whole of Somerset. We've spread it nationally. We've had conversation with the Caribbean islands. And then it led us on to other things. So we went to retirement villages and we've talked to carers to replicate the project. And we've done the same thing in retirement villages of about 300 people. And we put a lot of boxes on the walls that people can put the medicines in that they're not taking with no questions asked. And we have collected kilos and kilos of medicines. And we put a pharmacist in the retirement villages, so it's Ask My Pharmacist, so they can then have a conversation. And we've done talks in their village halls called Me, My Medicines and the Environment, because it not only affects people, but it affects we improve things for the NHS, and we also have a massive impact on the environment. And talking to people about the impact on the environment and what we're doing to marine life and antibiotic resistance had a massive impact on people. And they've taken over these projects in the retirement villages, and that's being escalated around the country as well. We've now gone into hospitals as well. We're process mapping the flow of medicines around the system so that when people go into hospitals, they will look at their medicines and not when they leave, because actually that might be the cause for people coming into hospital, that they're not taking their medicines. And it's also looking at the person, because there's no point me prescribing medicines for someone 4 times a day if they need prompting. It's really simple. It's a conversation with people. If their carer comes in the morning, only prescribe it once a day. And people get really worried about stopping medicines, but it's okay to have that conversation with people. And there's something about us as prescribers, about the language we use as well. So I think there's a document from the British Geriatric Society called Lost in Translation. And they talk about the person who uses their inhaler and sprays it on the dog because the dog causes their asthma. So, you know, and I've come across people who people have wanted me to admit because they're drowsy, but they're taking their sleeping tablets in the morning. You know, this isn't rocket science. This is really simple, basic conversations that can absolutely make a difference to people, the environment, and the NHS.
It's quite interesting because right early on, Hugh, you said you like regulation. I like regulation too, but it's very top down.
Yeah.
And what Debs you're talking about is this sort of grassroots and up. And actually, you can probably have large change. There's some critical mass, isn't there, where there's enough people doing this around the country where you actually do get behaviour change. And it's not a nudge. So it's very different, but you can get, because it's the non-linearities we care about, isn't it? We care about the tipping point non-linearities of climate change, which is why we're trying to change the odds in our favour. But we really care about the non-linearities of term, whether it's technology adoption or whether it's big behaviour changes. And I think that's a really nice example, but it requires sort of detailed thinking, doesn't it? You know, it's a lot of detail. It's very local specific and context specific. And I was thinking there's other examples, just like, with air pollution, heat, and an asthma attack. So, Ella Casey-Dibridge, the poor little girl who died having an asthma attack because she was outside trying to get to school when there's high pollution and high heat. But there's lots of different entry points if we talk about sort of solutions. And much as regulation is important, all those environmental policy instruments, whether you're pricing or price regulation or nudges, but actually some of these initiatives from the bottom up, you can have really big change. You can have them quite fast, can't you? If you really figure out what works and enable this to be implemented.
So a big part of what we fundamentally believe in and do is facilitating that. So whether it was socialising aspects around Ella's Law and the changes there, people think air pollution is a Victorian industrial revolution change. No, this is the first person to have air pollution on their death certificate in 2013, wasn't it? And Debs is a perfect example. So what we can do is not only help with sustainable communications, the way in which we're starting to work with the pharma industry, but actually shine a light on it. Because as much as anything, there is a level of fear of missing out. There is a level of championing successes that is hugely infectious in this space. And actually that's as successful as you say, top-down regulations.
I guess the point I really want to make is you need both. So if you're thinking about designing for systemic change, and this is what I spend a lot of my time thinking about and doing, there are actually 9 levers you need to pull to shift systems, and they range from the levers at the beginning, which is kind of access to information, making the case for change, information flowing differently through the system, so it is configured differently and reaches different people. And then you have to have access to capital. You then start to think about behaviour change, and actually regulation is often at the sort of the latter end of any big change, because that is how you then implement the rules of the game. Regulation can only, it tends to work when you've got societal acceptance of an issue. And so if we think about climate and health, and we've done this in our guidance document, we've mapped out the 9 levers according to startup phase of systems change, accelerated system change, which is where we are right now, to the stabilisation of a new system. We can then understand how different parts of the system can pull which levers and do it in a coordinated way. And that's the bit that shared understanding is missing at the moment.
I think it's a really important point. So I'd like to pick on both of them actually, because in the health system where we both work, adoption is incredibly slow. And Bayer must know this too. We've got a drug to market. It takes a ton of money and a huge workforce to penetrate the thick skulls of doctors like me to get us to start doing stuff. So even things that work really, really, really well, adoption is incredibly slow. And I wonder what the secret sauce is to how we take the sort of thing that you're doing and have it replicating at the speed we require. The same with the asthma inhalers. We know that if you ask a patient, did you know that that inhaler is very bad for the environment? Most of them don't. If you ask them if they're worried about it, most of them are. And if you ask them if they'd switch to a dry powder inhaler, 75% say they would. But we don't spread that out there. And I come back to the point that if the speed of change we need for the climate isn't hanging around. We need to be at zero emissions within 9 years and drawing down. And that's going to require us taking these sorts of examples that you were pointing to, Liz and Sally, and finding a way to have them out in weeks and months. So how do we do that, do you think? And I'd perhaps like to bounce that back to Vernon as well, because that's your industry's job too, isn't it? And Bayer, you're...
Can I make a quick suggestion on that? I mean, it's not the full solution, obviously, but it comes back to something, Vernon, you said right at the beginning. You know, are the incentives there? And my answer to that absolutely is no. The incentives are not there. And despite the fact that the work that Liz and I do on economics, despite the fact that Economics 101 says that prices should reflect environmental damage, inevitably they don't. And all efforts to put carbon pricing, for example, on the agenda, we can't even stop subsidizing fossil fuels, let alone putting carbon prices on them. So absolutely from where I'm sitting, the incentives are all wrong, and it's inconceivable that industry generally is going to move in an environmentally sustainable direction while that is the case. There will obviously be leaders and people who manage to buck the basic market signals that all businesses get through the market, but the majority of businesses will not. And if we come back to the finance sector certainly won't, because their business is making money. And if you can do something that is cheaper because you manage to put the costs on someone else, which is what externalities mean, that's what they're going to do. And they're going to keep on doing it for as long as that makes financial sense. And we've just got to grip that, because there's no way it's going to become mainstream without the financial signals giving the environmentally sustainable signals.
But I think that's changing, Paul, and I am an outrageous optimist, just to put it on the record, because what I think is happening is we're seeing alternative pathways to value creation emerging. So we have nascent payment for ecosystems, business models, which are using carbon credits. We have a project in the US which we're working with partners to use carbon credits that then allow cotton producers to shift from conventional to regenerative cotton. We're seeing huge amounts of capital flowing into nature-based solutions. HSBC has got a whole department on sustainable supply chain financing. What I think is beginning to happen, and you may violently disagree with me because I'm not an economist, I am a humble environmental scientist, but what I see happening is capital flowing into solutions, and I see standard instruments like debt instruments being used to incentivize the right behaviours. So, for example, Olam, another organisation we work with, big agri provider, they've got a $2 billion loan facility with HSBC, which is discounted according to how rapidly they can decarbonise. So for me, these are signals of a system beginning to sort of reform, repattern. My worry is it's not happening fast enough, and there's a lot of vested interests or resisting force in the system that don't want that to happen. And I think this is where we are at this moment in time. We're seeing these green shoots of alternative mechanisms emerge. We're seeing capital getting allocated in different ways. And we're seeing the leaders kind of promulgating that. But as in the energy transition, as is any case for an economic transition, there are very well-funded, powerful, resisting forces. And the only hope, the only kind of crumb of comfort I take from that is from a systems perspective. The closer you get to a new system emerging, the harder the existing system fights back. And that's why it feels so hard right now, because we're right in terms of the energy transition, we're kind of nearly there. But there's a big vested interest that don't want that to happen. So I absolutely agree, unless economic models shift and the signals from the market shift, then actually, if your primary responsibility is shareholder return, you can't do very much. But I wonder if the economy is beginning to shift, and that just might be the bits that I see, but I am an optimist.
I think that's the world that you work in.
Yes.
And I think outside that world, and the numbers of companies that Forum for the Future addresses, and I'm entirely supportive of that work, as you know, I think there's a whole mainstream economy out there, some of which is actually going in the wrong direction. I'm looking across the Atlantic here, some of which is going hell for leather in the wrong direction. And I think that's basically because the incentive structures are wrong. And on the individual case studies which you've mentioned, I could have pointed to exactly the same going on in the early 80s. And there have been shifts and changes, but we're still using 80% of our energy comes from fossil fuels. So for me, I don't see the transition. If the transition is measured by fossil fuel proportion of energy use diminishing, and to me, I can't think of a better measure, that is still not happening.
One of the key phrases that you sort of brought up is fiduciary duty to your shareholders, right? And at the moment, the fiduciary duty to your shareholders is basically to destroy the planet. And we want to align it, don't we? Whether it's through pricing, whether it's through carbon taxation and a Pigouvian tax, or whether it's through regulation. And we're always going to be fighting against that. Yes, the lobbyists as well and stranded assets, but that's always going to be fighting. So how we align fiduciary duty to the shareholders with not destroying the planet is where we want to be as economists, isn't it?
Yeah.
So how do we do this? Because this is very difficult, isn't it, for a company?
So it is really difficult, but this is where, and we're in here in the surroundings of Havas, your communication experts. This is where stories really, really matter, because there are examples already, and Paul, you're right, it is the world I live in. I deliberately put myself in a world with organisations that want to shift the systems. But and I know some of the examples were there, 20 odd years ago, but there are more today. And what we need to do a much better job of is shining a light on the actually publicly listed companies. They do have this fiduciary duty, but they are saying to their investors, how we're going to deliver this fiduciary duty is changing over the time as these externalities do instinctively get priced in terms of supply chain pricing. They're already getting priced in right now. But what we're not doing a very good job of is shining a light on these alternative models, showing that they can work, because it's a different narrative. And I think the choice we all have in this room today, and not to put us all on the spot, is how committed are we to trying to create a different narrative and tell different stories? Because if we don't do that quickly, then we know kind of what might then happen.
Can I ask Sally a question? Sally, you've been working in this area for a while. Why do you think we haven't been able to get the story right yet?
Oh, lots of reasons. I think Vernon probably will have a better answer. One, we haven't made this relatable. We've hit people over the head with stats, figures that just don't mean anything to them. Two, we've used language that no one understands. And I'm a big corporate here. I talk about a just and regenerative future. And people are like, oh, no, it sounds nice, but I don't know what she means. And so you have to break it down into it's good for your health, it's good for nature, it's good for your communities. We haven't, until quite recently, had evidence, enough of the proof points. And first and foremost, we just haven't made it relatable. We haven't met people where they are at. We haven't put ourselves in the shoes of the company finance director who has got to deliver the fiduciary duty. And it's like, I don't know how to do this, which is where all of our countless guidance documents come in. So I think there's a number of reasons, and we can address each one of them.
So I'm going to come on a couple of angles there. So the way in which we approach things and the purpose of things like this roundtable, and we're going to come to what are we going to call for and what are we going to do for those calls to action thereafter, right? So for starters, we fundamentally believe that we have a role to play. When you actually look at people's personal carbon footprints, advertising is a significant contributor, and we've been a massive contributor to excessive materials that have not been sustainable. So as of the last couple of years, we're doing an net zero approach, a sustainable approach to digital optimization, and changing the story. So we have a way of assessing campaigns and the way in which we're talking and using campaign imagery to normalize some of these discussions, because they've seen airy-fairy in the future for the wealthy few that can think about them, not related to everybody's day-to-day practice of getting a bike around London, what that actually means and how dangerous it can be. So we're actually looking at the way the semiotics are used, the language that's used, and personalising it as making it as fundamentally personal as possible, right? That's the only way to make things stick and resonant. What we did with last year's white paper, and purposefully, was to try and bring people together, to give them a voice, to amplify them and to socialise them. And part of our role as a facilitator, as a conduction agent for joining dots up. So part of our role is to actually join other people up across stakeholder, and actually just amplify those stories. Those brands that are doing a good thing, because we know they're going to generate more consumer engagement, whether they're HCPs or patients using those products. So we want to hear the success stories, and ever the optimist as well, is to promote them and to get them out there and to normalise them, because there are fundamental challenges with communications and with politics at the moment that are at odds with sustainability.
I was recently on a panel at the Royal College of Paediatrics and Child Health. They had a panel on environmental issues, and great. We had a great conversation. But the absolute standout moment was their children and young persons group, and actually hearing from them on basically saying, we want you, as in healthcare professionals treating us, to tell us about the environment and my medicines and my condition. And just in terms of the, if you like, the call to action of why this is so important. And, it's not just older people, it's actually, the young people. And they were super eloquent, super clear, no doubt. It's like, we need to be part of this conversation about our medicines, our conditions and the climate. So I just wanted to share that before we get into the
And I would echo that. It's giving the stories to people and empowering them to make their decisions, but actually telling them what's happening, because I don't think people actually understand how bad it is and how much effect we're having on our planet.
We also probably want to, I think we sometimes have disagreed on this, but I think we do need a positive message that tackling climate change is a positive thing. That actually, if you were going to design, if you're an alien looking down, right, on the planet, and you look at a sort of middle-income country and a city where people are living, you'd think, why would people choose to live like that, right? Unhealthy lives, sit in our car, drive to our office, drive back, air pollution, eating unhealthily. You wouldn't design a world to look like this. And so, a lot of people say this, but even if there wasn't climate change, wouldn't we want healthy air, healthy eating, active lives? Access to healthcare. Not seeing waste, and so people who need healthcare not getting it because we're doing stupid things. So I think we've got to make it positive, because certainly many of us may have sort of teenage kids or teenage plus, but I think that's kind of fed up of us looking at them and go, okay, you solve the problem, but at the same time they are the future.
So this is really helpful, and I've made a few quick notes because I'd like to bring some people in specific points. So I think you're right. The alien looks down and goes, people wouldn't want that. But of course, there are large sectors that are driving that do. And if you look at the food industry, they have known for a long, long time the harm they're causing, and they just don't care that there are people dying of everything from cancer and diabetes and anything else, because there's cash in it. I've met a C-suite of a big fossil fuel company within the last fortnight on the fiduciary duty point, who just said, Hugh, you just got to understand, our job is to make money, and we make money by drilling oil. That's the end of it. Nothing else features on this. So we have got big sectors that still really genuinely don't care. So my question, I suppose, to everyone here is, how are we going to sort this problem out? Because that's what we're here to do. We've got a few choices. We can get the messaging out. We can gang up. We can get the pre-competitive conversations and say, well, we don't actually care what the legislation is. We're just going to do it anyway, and everyone else will have to catch up. I like the idea of that. We can gang up to try to get the legislation changed and the regulation changed, to say, we would like you to create a level playing field in pharma by mandating the following things. Those are just a few examples. But to take Vernon's point, rather than this just being a hot air chat and we all go away and think we've had a nice conversation and pat ourselves on the back, what do we want to come out of this? What would you all, if each one of you, what would be the thing that you would say at the end of today, we all buddy up to do this to make the difference? What's the solution?
So for me, it's actually coming back to something what you said, but really stick with me is asking your patient what matters to you. So for me, it's going out and listen to understand what has been missing so far, to mobilize people, to make them aware and to get them on board, so that there is like a more critical mass existing that is pushing for change, and that there is an active request. So for me, the next step would be to understand what can we do better. How do we get more people on board so that this movement is gaining more
That's great,
speed?
and that echoes your bit, which I strongly agree with, by the way, that big pharma and big companies have missed out on the power of their workforces. You've got huge numbers who work for you. And if they all change their behaviours, so that's one thing we can do then. We're all going to talk to our patients better or find communication ways. Havas, I think, have just committed to working pro bono on that for you, which is a good thing.
I'll take you up on that.
The big thing where we're failing, actually, is in getting across the message that mitigating climate change is good for the economy. And I'm hearing, mainly in newspapers that I don't read, but I try to monitor them, the narrative that Britain is going bankrupt because of net zero, and that's already now penetrated the Conservative Party, the main opposition party. We know that reform is going hard down that line. And while I'm very interested in and hearing the need for bottom-up initiative, this isn't going to happen without really big policy intervention. And that drip narrative that doing stuff about climate change is too expensive, which is what I'm hearing the whole time. A, it's enormously worrying in the sense that it eats away at the political will to do that. B, it's just wrong.
Well, is that something that
you know,
businesses...
whether it's CBI economics, whether it's next turn, whether it's you know, government report after government report is that this is good. For some reason, that penny is not dropping in the public space. And to me, the message is very simple, but it's not being heard. That climate inaction is very bad for you. So climate change is going to be very bad for us. That doing something about climate change is very good for your health, which is the basis of this conversation, for all the reasons that you said right in the way. And thirdly, it's good for the economy. And if we don't get the economy moving, you know, this emphasis on economic growth derives entirely from the need to provide healthcare to an aging population. So we don't get that economic growth, we're not going to have a healthcare system. And yet, the way to get the economy moving is to go hell for leather for net zero. But that message is not getting through. Quite the reverse, that message is being subverted by the interests that you were mentioning. The interests are going again, the fossil fuel interests, and all the other guys who benefit from the fossil fuel intensive economy that we build. They're systematically subverting that message, and we're not putting the counter message.
So let me put it out there. Is it something that the economists in the room could do, and not criticism, that you could be more vocal and get your message through? It is also something where the businesses in the room would be able to stand up and change that narrative, to say that we in pharma, or we in all of the other businesses that you represent, say this is good and we want it to happen. Is that something that would be a helpful thing to do? I'm looking for the solutions here.
Yeah, I mean, I think shifting, dare I say, the narrative is critical here, because that then creates the conditions for the policy changes, for the incentive structure in the economy. And Paul is right in that objectively, logically, we know that a healthy planet gives us healthy people, gives us a healthy economy. We cannot have a healthy economy without the two other things. We just can't do it. Yet there are these very powerful forces that are sort of, you know, strangling that message. And so the question in my mind is then, how do we really effectively and quickly mount the counter narrative, which is the narrative we started with, which is healthy people, healthy planet, blah, blah, blah. And I think that is where, for me, and it's, you know, part of the work we do at Forum, is to really try and advocate for private sector leadership. You know, we do need businesses to stand up and say the pathway to net zero, it's good for business, it's good for lots of other aspects of, you know, the issues that reflect our business. And then you're circling back to the business case and back to employees, because actually what's happening in the US right now is obviously lots, but one of the reasons why actually more companies than you would know about, because they've just gone quiet, they haven't stopped, that one of the reasons they haven't stopped is their employees who are saying, we can't stop on this, either net zero or D&I, we care about this. And so we need to kind of leverage that business case, I think, to elevate the voice of the private sector leaders who are very clear about the pathway to value creation. And that's the other point that people struggle to understand, is how we make money today will not be how we make money tomorrow, because tomorrow we'll have resource scarcity, we'll have a really volatile climate. Pathways to value creation are shifting the whole time. And what I spend quite a lot of my time doing with executive boards is going, right, this is how you make money today, but this is the future we're heading into, a climate constrained world, a resource constrained world, nature collapsing. If we carry on, structural inequality headed in the wrong way, so mass migration, civil unrest, how exactly are you going to make money in that world? Oh, okay, so we don't want to do that. So then how do we modify what we're doing today? And so that's the bit that people find really hard, because ultimately what we have to hold is today, tomorrow, and the path in between. And that's complex, but we can break it down with stories.
I'm just trying to work out what I'm asking all of you, because I don't know the answer to that. How do we pull this together? We've got the Sustainable Markets Initiative, we've got what you're doing, but to Paul's point, we're up 0.8% on emissions last year. Greenhouse gas concentrations rose the fastest rate ever recorded last year. We're going the wrong way. How are we going to change things from this room? How are we going to leave? So if we keep doing what we're all doing, we're not going to get there, are we?
So one thing I could potentially add in terms of the hearing the conversation here, everyone here is an expert, preaching to converted, right? Everyone believes what we're here to talk about. And I think to your point and to your point is feels like too much we're talking down to be, and maybe we're sort of missing out the general population who tend to influence shareholders and corporations and laws and governments. And governments change rules very quickly when they feel the public want them to do so. And I do feel that we fail generally to communicate and to articulate in a simple, clear fashion what the imperative is and why it's important to the average person on the street. I think we're communicating too often to the bubble of people that have already bought in. They bought in 10 years ago. They're willing to spend their money to support climate change. They understand to invest in health, but they're not the general public that exists in this country. That I feel like I don't think we've got the argument that we could take onto LBC and have a debate for an hour about right now. I don't think we've articulated simply for the general public to get behind this, to push everyone else. And I feel ultimately all the people we're trying to convince will move if the public understand.
About if buyers' drug boxes, much like cigarette packets, have got the pictures of rotting lungs and dying people on the front that's meant to put us off?
I think that's where we are now. We're doing the negative quite well. We're telling people off.
But I wonder about the positives. I wonder about, what happened if the drug box, certainly in our pharmacies, a lot of the packaging is blank. What if they carried a message, some simple facts and things? Would that be a way of the pharma industry communicating?
I think what I would love to hear.
That's a terrible example because the cancer-ridden lungs on cigarettes didn't do anything. Banning cigarette smoking in pubs and other places.
I'm suggesting the opposite. I'm suggesting that you use it to carry the positive message, saying, while you're opening this packet and popping your pills out, looking at something that's saying, here's something you could really do that will make a difference to your health and make a difference to your planet.
Very much so, because that could come into medicines optimization, recycling, all sorts.
Yeah.
I just want to also add a slightly optimistic, hopeful point, which builds a little bit on what Sally was saying earlier. The reason why I got interested in this space is because when I first started to become aware of how climate change was impacting health, I could see this massive opportunity for the life science sector to have a really big impact. And why did I say that? Well, because I'd been working on drug launches and I'd been working in respiratory medicine, and I'd seen epidemiological data that showed that when we launched a new inhaler, we were able to reduce mortality in many markets around the world. How did we do that? Because we were good at educating, because we were good at shifting behavior, because we were able to do that. If we were as a commercial workforce, when those resources lined up behind the mission to bring inhalers to patients to reduce mortality, we actually achieved that. So we can do this. That's the thing. We have got all of the capabilities we need. I think one of the things that tends to be missing often in this whole jigsaw piece is that we're losing our sense of autonomy. And we have to help people not only to see that story, but also to understand they're a part of this story, and they have things that they can do that are within their circle of control, and they have many things they can do that are within their circle of influence. And I think, so the thing that I'm working on is medical doctors working within life science sector. There's so much more that we can do, because this is our job. This is actually our job, to improve patient outcomes.
But I'm just thinking there again, this is great. I take your point on the asthma inhaler stuff, but let's imagine your packaging coming out with your inhaler or your asthma medication that also points out that a diet that is based upon vegetables and fruit lowers your instance of asthma and your asthma mortality, and actually reduces your instance of a bunch of other autoimmune diseases. And we know those are true, and the trials will demonstrate if you Chaffinch, for instance, introduce fruit and vegetables and up it, asthma rates drop. And that's a low carbon.
I think if we want to improve how we educate people on primary prevention, we need to become increasingly creative. And I don't know if packaging is going to work. I think we might need the expertise of
There was a lovely example, we were talking about it earlier. New York hospitals.
Yeah.
One of the
That's
New
a
York
great
hospital
example.
networks they wanted to introduce plant-based food, right? But don't call them vegan-based meals. They actually said it was a chef special.
Yeah.
They had it on a leaderboard. This was the preferred choice of the
Yes, it's
day.
really good.
It was cheaper. It had reduced carbon, and they're rolling it out in 200 hospitals. And the patients actually enjoyed eating the food and reported as such. They had we were talking about as well.
Yeah.
Reduction in hospital stays on the basis of more nutritional food, which it's a win-win, a massive opportunity. But again, it's about framing things in a way that matters most to people, everyday people out there in the communities, right? And not in a way that we often hide behind data or complexity to try and get a point across, right? Which we need to impact people emotionally and meaningfully where they are.
Yeah, and fundamentally, what happens next is going to be a human story. It's going to be a story of what we all did as individuals next. And if we want to change what happens next, we have to communicate in a human way.
We can also litigate.
We can try that too. But it's back. We need multiple levers. It's really a case of everything, everywhere, all at once, now.
Going back to, I fully agree, but are there any policy asks, any legal or financial incentives, disincentives? Is there something that hasn't been raised as yet today that is an effective tool or lever to work on?
Litigation's been shown to more align fiduciary duty to shareholders with not destroying the planet, because there's a paper that's come out that shows that the fossil companies that are more litigated against, their share price goes down. So there's lots of ways that we can go outside of government, right? And one is people choosing. But we've got to remember that we're a certain demographic sitting here. We're not the single mum who gets up in the morning and has to make 100 choices. And, asking anyone to wake up in the morning and, are you going to be a good person today? Are you going to make good choices? But so I think there's a lot of how we align. And it can be partly through the narratives and consumers making choices that align because, for whatever reason, you feel good. And we've seen consumer choices with what's going on in the US. Consumer choices, for example, about what car to buy, has had an absolutely massive impact on sales and a massive impact on share prices. So we've seen more rapid change than I think anyone would imagine in terms of consumers individually choosing to do something and having a hugely measurable impact. I think litigation is great. You don't really want to litigate, but we can now attribute poor health outcomes to climate change and emissions. And if you can do that, even the threat of litigation or having some examples of litigation can realign shareholder value with not destroying the planet. So I totally agree with you. We need to do everything, but there are some big wins, and the ganging up. Rather than this problem that because it's a global public bad climate change, defection is the natural thing. So not cooperating to save the planet. But if you can start bringing clubs together of companies and clubs that say, actually, we want to do the right thing, and we level the playing field by committing to it. It'd be great if the government would regulate, but if the government's not going to regulate, at least if we commit to doing the right thing. And then you can get that feel-good factor that consumers see, that workers see, that people want to be part of that club, rather than want to defect out of this sort of global need that everyone has to cooperate. I'm becoming a horrible techie economist now.
Well, I mean, it's interesting that you took the example of, the single parent who's a deprived part of the community and stuff. And obviously that's a very important part of the message that one looks after that. But the people who are destroying the planet are the rich. They're not the poor. The proportions there are very, very clear that 15% of the population produce 50% of the emissions. So what I'm looking for, and what I've yet to find really, is how to make this something that the elite aspire to. How do you make a low carbon lifestyle really smart and give people ways of showing that they've got a low carbon lifestyle? I mean, in my street, the only thing I can see in southwest London is rows and rows of SUVs. So that's the status symbol there, and any notion that these people are wasting their money because they're not, 90% of the time it's standing outside their front door. That's precisely the message. These things aren't for getting from A to B. These things are messaging, this is who I am with this kind of motor car. And it was so interesting when electric vehicles started being advertised as electric vehicles on the television, because they were adopting exactly the same reasons for owning an electric vehicle as you own any other kind of vehicle. This was coming to be the smart thing. And if it was an electrical SUV, which of course takes twice as much or 3 times as much critical minerals being dug up in countries all over the world. So I'm looking to you as the communicators to create that smart feeling around the low carbon lifestyle. And so far it's not emerging like that at all. Quite the reverse. You know, it's all about private jets.
Exactly what you're saying, Paul. We have to stop aspiring to this destructive lifestyle and get those really key people who people follow to actually reject this excessive lifestyle and make it cool. It's not going to happen, but it might.
Well, actually, so luxury brands can be inherently sustainable because a luxury item, if it's a watch, so I sit on the advisory council for Bentley Motors. When Bentley have got a really long life of cars, you know, they just go on and on and on and on and on. But so a lot of luxury products are designed for longevity, are designed to be literally passed from generation to generation. And I'm really interested in understanding how do you leverage the power of luxury brands to shift behaviours and to really build on that sense of luxury, which is we'll hand it down to the next generation. There's something there that, Paul is right, hasn't been fully untapped, but I don't think anyone's had a really serious attempt.
You never own a Philippe Patek. You just
You
look
hand
after it for the next
you're a
generation.
steward.
But when you see a fridge in the 1950s that would last for 40, 50, 60 years, built-in obsolescence drives,
Yeah.
you know, from productivity and economic return, right, has driven built-in
And that's where the
obsolescence.
circular economy is really
And-
powerful because that would get rid of that. Emma talked about jigsaw. In a way, the bits of the jigsaw are there. They just haven't been assembled in the right format.
Yeah, absolutely.
And I just want to maybe build on a little bit of this conversation. What I see is also the need for inner-led change, for outer change. I think we also, maybe this is going a little bit too philosophical for this conversation, I don't know, but in my mind it links to human health in a very profound way, is what is it about our human existence that is meaningful to us? Can we find something that is common regardless of which country we live in, which demographic we represent? What is it that's uniquely meaningful about living a human life? And how can we articulate that in a way that's visionary, in a way that actually gathers hearts, minds and souls? And I think that is very hard work to do, but it's work, especially those of us that have the privileged positions that all of us do, that I think we need to take very seriously. So I just want to inject that as well, because I think that's often neglected. We expect the outer world to change without thinking how we need to change as individuals and as communities. I think that's also important.
Sheila, to you, and then...
Quite a different, a very practical thing, thinking about developing medicines and medical technologies. I think there's a very specific piece of work about translating what sustainability means to those people working in life sciences in the different disciplines. So as Emma said, you know, if you're sitting in medical, you might have a great sustainability team making sure that the solar panels on the roof work, but what does that mean for me in my daily work? And that needs to be done across all the bits. So the example we were talking about with the clinical trial protocols, great example of I can write really great clinical trial protocols and they're doing the solar panels, but how do we bring those two people together? So there's something about, and that would be a cross-organisational piece of work to say, how do you translate that into daily practice for people working in innovation? I think there's something about how we connect innovation with the health needs, those that we can predict and those that we can already see with certainty, and then also equipping us for the unknown. So things like older people with multiple long-term conditions who are taking 20 medicines, actually, if we know what those clusters of conditions look like, can we not be doing smarter development of medicines and solutions for them that actually work for them? Child health is another one. Can we get better at that? How do we use medicines and technology in combination? And obviously also more on prevention. So whether that's vaccines or other types of prevention. So that kind of, we already know we've got an older population, not going to have enough people in the workforce. What do we need medical technology wise there? But then also equipping for the unknowns, which will come, the sort of, you know, whether it's emerging infectious diseases. And then I think I'd come back to the earlier point I made about young people is really kind of understanding what do young people want to know? What are they wanting to know? How do we, what do they expect? How can we support them? Because as we've just been saying, it's their planet that we're kind of looking after, sort of, not at the moment.
Can I just really quickly say, this might be really simple, but for me, it's about making the abstract real for people. It's about, there is value for healthcare professionals in getting it right for the people that we look after. So there is a feel-good factor for person-centred care and helping the environment and saving NHS resources. So we can always think about that. And it's about the stories that we tell to different populations to make this work for people, isn't it? And giving autonomy to people.
And just a shameless plug, we have created guidance for healthcare professionals to incorporate sustainability, but it's sort of languishing on our website. So do take a look, because we could just adapt it even further. But we've had a go at trying to make this meaningful for different parts of healthcare.
Brilliant.
It's a starting point.
Shall we wrap up?
Yes.
Do you want to summarise your thoughts, and I'll do the same, and we'll draw discussions to a close?
I remain frightened. I think we still have to come back to the speed and scale of change we need to have, because being well-meaning doesn't cut it. And I think everything we've talked about in this room can contribute, but we've got to have some sort of engineering plan as to how we're going to get to zero in 9 years, because that is a massive challenge, and our lives, and I'm 62, and that of our children does depend on us doing that. I think the benefit we've had today is a very cross-sectoral involvement, actually, and I think it's been really helpful to hear from economists and people with interest in law and marketing and engagement and drug companies and trials and so forth as well. What I've heard is, and I suppose I'm perhaps reflecting my biases, I think there is something about going to the individuals through companies, so the companies going to their workforces and saying, you need to move your bank, you need to move how you travel, you need to move how you invest, you need to move how you power your home, you need to move what you eat. These things will make a difference. We will help you do that, and use those people as emissaries to others. We've got power as individuals to talk to our patients and our colleagues to get them to change. There may be a synergy between the companies and the rest of us, and Havas and others, about how we work together to create that new narrative, using your example, that maybe there are ways that you can live a low-carbon lifestyle that also stops you getting asthma. But when you have it, you need to use our pharmaceutical agent. I think that could be helpful. I think there's something too about Paul's point, about us coming together to say, we in business or academia, and business I mean not just pharma, but Havas and others too, we support this. We want governments to be ambitious and start getting vocal, because Paul's point is right. The narrative at the moment is business doesn't like this green crap. Excuse my French. So perhaps we all need to step up to the plate on that issue as well. Those are your takes.
I fundamentally can't believe that people don't understand that there is no society without a healthy society that is sustainable. And still, even after COVID so recently, etc., and this is not so long-term now in terms of climate change, I think it's been wonderful to hear from everybody from their different perspectives. There are clearly some fundamentally really important things happening, still in pockets, still disconnected, whether that's international, from a trade perspective and collaborative and a business perspective, or whether it's at a local grassroots level, with activating patient groups, with patient advocacy, with healthcare professionals, setting up their own local initiatives. I think we have a role to play to help stitch these things together. And if we can't make those messages sticky and resonant and meaningful, we have failed in that. We have to compete with a lot of noise out there, of competing interests out there. And frankly, I think that needs a bit of activism. So with that, I thank you all for your participation and rich discussions today. And we will be presenting this and then following up and looking for opportunities for us to collaborate and do some more things. So thank you very much for your time today.
Thank you.
Thanks everyone. Yeah, a little ripple for everyone else.